Morning, everybody. Dr. Patmos. It is May the 4th, and there is a very interesting story right now in the news that involves infection control. And as you know, or should know, I'm an internal medicine specialist, board certified with added qualifications in infection control. And this story is very important because it's an active, ongoing, unfolding situation. Lives are at risk, and I'm not sure that it's being handled correctly. And I'll tell you what I think needs to be done. And it also goes to show you why being an infection control specialist is often a very unpopular job. Uh, every hospital has an infection control department, and it's usually staffed by a small number of people. Control nurse. Sometimes there are infectious disease doctors that consult with the department if the hospital even has an infectious disease doctor. And typically, infection control departments in hospitals require hospital employees to do certain things, like wear gowns and gloves and masks, and they impose things like universal precautions, and they take all these interventions in hospitals to prevent and control in-hospital infections and reduce iatrogenic infections. And it annoys everybody because it requires that people do things that they don't really want to do. It slows doctors down because they have to put gowns and gloves and masks. It costs money, and hospital administrators don't like it. So being an infection control person in a hospital is often a lonely, unappreciated job. But if you want to control infections, you got to do what infection control says. Well, here is a perfect example of that. Right now, off the coast of Africa, there is an expedition cruise ship with 150 some people on board, three of whom just died of Hanta virus. The World Health Organization is apparently investigating this or involved in this situation. And this is a breaking news story. Three people on a cruise ship die of hantavirus. These are German people, I believe, on this expedition cruise ship. This is not one of these big, like Norwegian cruise lines with 1,000 passengers. This is a smaller expedition cruise ship. It only has 150 some passengers on it. So there are three passengers who are dead, and apparently three more who are sick. And apparently, the dead ones have been confirmed to have had hantavirus. So they're all trying to figure out what to do. Meanwhile, the ship is anchored or stationary off the coast of Cape Verde, Africa. No one is being taken off the ship, and no one knows. It's not exactly clear what they are doing. So you have people on a ship. They're confined in a closed space, not allowed to exit. The ship is not being allowed to enter a harbor, floating off the coast of Africa, where three people have died of hantavirus, and three more apparently are sick with it. They're trying to air evac them off the ship. Well, here's what they need to do. First of all, you have to understand hantavirus. Hantavirus is a deadly virus that is transmitted by mice, and it is found in mice droppings, where you see mouse droppings. Mouse urine is where you will see hantavirus. It's typically found in cabins. I think the first reported cases were in cabins in Yosemite, where there were mouse droppings, and it's not a common thing. It's associated with mice. Well, what does this have to do with cruise ships? Well, if you know anything at all about boats, you know that boats and ships are places where rodents can get on board. How do they get there? They climb on the dock lines and get into the boat where the food is stored. We can also get there on containers and other items that might be brought onto the boat that are contaminated. There's a scene in the Titanic where there's rats running on the boat. Anybody who's around the boats knows that rodent contamination and rodent infestation is a problem in boats, and you have to be active and vigilant about dealing with this. So here you have three people on a ship who get hantavirus. Now, hantavirus can be transmitted person to person. That is vanishing rare. There are apparently a couple of cases in South America, but most of the cases of hantavirus have been due to direct contamination by rodents and aerosolized hantavirus from rodent and urine and feces. So It requires inhalation of the virus. So here's the most likely situation given all of this. This boat, this cruise ship, is probably loaded with mice, and the passengers are being trapped on it and exposed to it continuously. Here's what they actually need to do. Yes, they need to do a thorough evaluation to make sure it's not influenza or Legionella or some other thing. That boat needs to be brought into a harbor right now. Everybody needs to get off that boat right now and placed somewhere in quarantine. But they need to get everybody off the boat, and that boat needs to be inspected for mice and mouse droppings and thoroughly and completely sanitized. All the rodents have got to be killed, got to be gotten off that boat. The boat has to be thoroughly cleaned and sanitized to clean all rodent droppings, mouse urine, and make sure that all the areas of the boat, the cargo holds, the kitchen, the places where food items are stored, all of that needs to be inspected and sanitized thoroughly. This is where you need infection control people. Now, guess what? In fact, if you were to do that, if you were to recommend that kind of aggressive infection control action, everybody's going to hate you guys. The boat company's going to hate you because they're going to lose a fortune. The passengers are going to be detained. Of course, they'll probably be happy to get off the boat if they realize they're trapped in an infected environment. But this is a perfect example of why infection control is not a popular job. I mean, nobody likes infection control people because we make people do things that are uncomfortable and impractical and inconvenient. But I'll tell you right now, as an internal medicine doctor, infection control doctor, this is not likely person to person spread. It's very unlikely. It's not likely that they got it on the mainland in Europe before they boarded the boat. Although that's a possibility, the most likely probability, put your money on it, is this boat has got mice on it. They need to get everybody off the boat and clean it, sterilize the entire boat. That's a big infection control project. And now you know why infection control doctors or infection control personnel are not the most popular people in a hospital. But sometimes you got to do what we tell you to do. That's what they need to do. If I'm following this story closely, I would not be surprised if more people get hantavirus, and I certainly hope that the captain of that vessel has ordered the crew to look for mouse droppings, and is taking active steps to get rid of the rodents on that boat. The staff are at risk too. This is aerosolized virus from rodent droppings, and everybody's at risk, including the captain. They need to get that boat into port, get everybody off the boat, and sterilize the thing. And from now on, listen to